Okay, meeting resumed. And before we resume the meeting, I'd like to say something on the time. I think that we have minimal chance of finishing this chapter. So let's inform everyone in advance that we have also preserved the 30th, the time slot. All right, between 9 and 12. It should be 9 and 12:45 on the 30th. We'll have another session on this chapter. Secretary and your team, I understand that you are informed as well. We try to ask more questions to get more understanding of this chapter. Ellen, would you like to take us through the second part of this session? Chairman, now about part 3, I'd like to start by asking the administration this. Now about the monitoring of sentinel events, the Legislative Council has on many occasions asked about the discrepancies between the monitoring of sentinel events in public and private hospitals, to the extent that the discrepancies have become illogical and unreasonable. For views expressed by members during debates at the panel on the health services meeting and the council meetings, these points were raised. Now, as far as private hospitals are concerned, the reporting system is voluntary in nature, and therefore there is a risk of underreporting, according to paragraph 3.6. I'd like to know the thinking of the administration or the Secretary on this aspect. Secretary. On monitoring and reporting of sentinel events, our attitude is that we need to ensure that these events are reported. But for some events or incidents, which might be sentinel events or near-miss events, reporting is still required, but reporting is voluntary in nature, but we do encourage them to do so. I emphasize that for sentinel events, reporting is necessary. Mr. Leung, for this reporting system for private hospitals, I think Secretary could confirm that the reporting system for private hospitals is very different from the reporting system applicable to public hospitals. So, is there any intention for the administration to align the two systems? Secretary. I think that throughout the world, there is no alignment of systems. We cannot make the systems identical. Now, as far as Hong Kong is concerned, this is a quality improvement system, and we hope that through accreditation of hospitals, we can align the two systems. Ellen. So, Secretary, can you focus on paragraph 3.6 of the report? According to the Director of Audit, because of the voluntary nature of the sentinel event reporting system for private hospitals, there is a risk of underreporting. So let me ask you this way. Do you agree with the Director of Audit's comment that there is a risk of underreporting? And then if you agree that there is a risk of underreporting, does the administration have any ideas on how this risk of underreporting can be reduced? First of all, do you have a mechanism to confirm or ascertain whether there is any underreporting indeed. Secretary. Chairman, of course there is always a risk of underreporting. Any particular reporting system will start from frontline staff, and the frontline staff may be affected by a number of factors. For example, when the frontline staff was made aware of the sentinel event, or the event being a sentinel event, and when the reporting was made, there is always a risk of underreporting. I cannot ascertain whether this has indeed happened, but we need to ensure that there is no underreporting. So, Secretary, how can you ensure that? Secretary. I cannot give a 100% guarantee, but most importantly, we should communicate fully with private hospitals according to our policy, so that they know in the future the regulatory regime will be more stringent. And to further ensure there is no underreporting, we need to step up publicity and public education. The messages should be disseminated to all hospitals and all frontline staff. Ellen. To step up education for patients. That is to say, whenever something happened to the patients themselves or the family members, the hospitals are required to report the event under this sentinel event reporting system. So does the administration think that the risk of underreporting would be minimized? Secretary. Now, about education that I mentioned, it covers both frontline staff as well as members of the public. Adam. Thank you, Secretary, for agreeing with me. Does the Bureau have any plan to step up publicity among patients and family members of patients? Secretary. I cannot give details of the plan at the moment, but like I said, the steering committee on the regulation of private healthcare facilities, a working group will be set up to consider this aspect. Mr. Leung, thank you. I would like to ask about 3.8A of the audit report. Here we see that the events reported by 2 hospitals accounted for 60% of the total 52 sentinel events reported in the year by all private hospitals in 2009. The breakdown is available under Note 11. So for these 2 hospitals, the number of sentinel events reported was particularly higher. So would the administration or DH step up monitoring of these 2 hospitals? Director? Well, after the sentinel events were reported, the DH would take follow-up action. Based on the nature of the sentinel events, if there is a systematic problem, the private hospitals would be reminded and we would follow up on the inspection. Director, Mr. Leung asked about these 2 hospitals. You mean the name? No, I mean how you would follow up on the 60% of the total sentinel events reported by these 2 hospitals. Mr. Leung. Now my question is, if the number of sentinel events reported had accounted for such a high percentage of the total events reported in 2009, would a closer watch be imposed on these 2 hospitals? That is, after they reported the events, after we understood the matter, should follow-up action be required, we would take a special approach in handling these cases. So according to director's reply, they would not say increase the number of inspections or pay particular attention to the related areas in the sentinel events. Director, please answer Mr. Leung's question. For sentinel events, well, it depends on the nature of the events. Sometimes after understanding the events, it might not have to do with the staff or the system. It might have to do with the patient's case. So basically, we would take a targeted approach on these cases, and if it had to do with the system, we would follow up on the matter. If it's a particular or an individual case, we would take the relevant follow-up action.
May I ask here, can you give us some information about these two hospitals, especially how you're going to deal with them? It is difficult to understand what you have done and how you're going to take up the matter. Chairman, I would like to add a point. I think the director really means that the number is one thing. The nature of the events and the causes of the events based on our investigation are more important. If the event involves the operation mechanism or system of the hospitals, we will follow up more closely. That's why we asked for more information about these two hospitals. Thank you. Next, Mr. Chen Ha-kan, Mr. Leung Sing, and Mr. Wang Yuk-man. Thank you, Chairman. In handling the sentinel events, I want to understand more about the administration's spirit. Para 3.3 and 3.9 state that now the reporting system is a voluntary one. They have taken on board the WHO standard, and the system is non-punitive and confidential. This is more positive so that private hospitals can go for self-perfection or self-improvement. But based on the director's report and actual circumstances, we're of the view that non-punitive mechanism is not quite feasible. The hospitals want to protect their reputation, so they will either hide the events, as in the case of case 2 in the report. It was only after 8 months after the event was there some follow-up. And it was only after patients' family members made a complaint before the Department of Health took action. So this proves that voluntary reporting mechanism is problematic. I want to ask the Secretary or Director whether they think that the current voluntary reporting mechanism is a failure. Why did the department tolerate the private hospital so much that the event was only reported 8 months afterwards? Why didn't you punish them or warn them? Secretary, first question first. Is the voluntary self-reporting mechanism a failure? I don't think we can take this matter in a too simplified manner. If it is mandatory, of course, it will be more powerful, but based on international experience, we understand that if the arrangement is very threatening or mandatory, frontline colleagues dare not report. So that's why so far our reporting mechanism is a voluntary one. In the future, as such as now, we have to do more education and publicity to make sure that the information flows to the frontline workers and patients so that they understand the importance of reporting these events. What about my second question? Why didn't they tolerate the hospitals? Yes, page 23, case 2 in 2007, the Department of Health just introduced this sentinel event reporting system. In this case, perhaps that's the first year, and the hospital did not report to the Department of Health very quickly. And after that, we followed things up, and we understand that it involved a complication after surgery. And later on, after we updated the sentinel events to be reported, well, this kind of event needs not be reported, because when we talk about complications, we mean that the medical workers have done whatever necessary. But after the surgery, the patients still show adverse reactions. So there may be these cases. And later, we updated the list of sentinel events to be reported, and this kind of complications need not be reported, because this is voluntary in nature. Private hospitals may need more time to report the case to us. Mr. Chan Hak-kun, Chairman, just now the Secretary said that if the reporting mechanism is mandatory, then frontline workers may feel a pressure not to report. But in public hospitals, there is a mandatory mechanism on reporting. So why is there such a big difference between the two types of hospitals? So why are there two different standards or criteria for public and private hospitals? Chairman, you just answered Mr. Leung's question. You said that you wanted to see uniform standards for public and private hospitals. Can you also give a timetable? Chairman, yes. As I said just now, the direction and policies are stated. But this is an example showing that the public and medical or healthcare workers, or if a person is not a healthcare worker, he may have different understanding of what sentinel events mean. As the director said, after understanding this case, the nature of this case is such that there is a complication. Even if no mistake was made in the surgery, there might be complication. So if the frontline workers are of the view that this is a complication and is not an event caused by negligence or a mistake, then he would not report it. Now, I would like to ask for some concrete data. 3.8, Table 5, starting from 2007, every year, half of the sentinel events are not reported within 4 weeks, according to the rule. So why such a high percentage? Now, if you identify this in the first year, then in the second year, the Department of Health should issue letters to ask the hospitals to report as soon as possible. Why didn't this done? Looking at the table, there are 5 events which were not investigated at all. At the end of the day, no investigation was submitted. So why didn't the director take follow-up actions? Are there some difficulties concerning reporting? At the beginning, private hospitals might not be very mature in tying their work with us. And then in 2011, we issued reports to urge the hospitals to submit reports to us as soon as possible. In 2011, we stepped up our enforcement work. And those cases you mentioned took place before 2011. Mr. Chan Hak-kun, now there are 5 events in which no investigation report was submitted. Why? Are you going to punish them? Or is it true that nothing can be done? Director, Chairman, for those cases, they are they involves report in the first year. 3 of them involves medical equipment. 2 involve complication during birth. So we sought an understanding of the events, but we did not see the need to issue warning. The last thing I would like to follow up is about referral of medical events. In para 3.1, ICAC recommended that the Department of Health should refer events to, for example, the Medical Council and Nursing Council for investigation. At that time, the Department of Health referred to the privacy ordinance, saying that they can do nothing. They asked patients' family members to take up the matter themselves. But today, in the Secretary's introductory remarks, he said that these cases will be referred. They will take the initiative to refer cases. So, in the past, why was there such a very conservative shield, and today, why is the Secretary so open-minded and willing to refer? Is it true that the privacy issues have been resolved, or are you just changing your mind? Or are you changing the approach of the administration? Secretary, what do you think? In the future, when we want to refer cases, we have to get the patient's consent before doing so. If you ask whether we are now more aggressive, yes, we are. Mr. Chan Ha-kan, you asked a second question. Yes, Chairman, can you follow up for me? Secretary, you answered a question from Mr. Leung about public and private hospitals. Do you have a timetable? And what are the standards of sentinel events in educating the public? Chairman, the public hospital spent a lot of time in laying down a reporting mechanism for sentinel events. They started that work in 1990, and so they are more mature in this regard. And now, in the private medical or healthcare system, we need some time to continue to educate and train people so as to reach the standard of public hospitals. In public hospitals at the beginning, we encountered similar circumstances. But then patients are affected and they spend a lot of money to be admitted to these hospitals. And there is also the regulation issue. We are not only talking about time. These sentinel events may lead to matters of life and death. So you are so experienced with public hospitals. Mr. Chan Ha-kan just asked you how you want to deal with private hospitals and what are your approaches. Chairman, in my explanations just now, I covered the situation in the past. If you ask for the way forward, our timetable is straightforward. The working group on regulating private hospitals is going to present concrete recommendations in a year's time. And during the interim period, we will communicate more with private hospitals and do more training so that the system will continue to improve. As regards timetable, after a year, in the working group's report, there will be more concrete measures. Thank you. Mr. Ng Leung Sing and then Mr. Wang Yok-man. Thank you, Chairman. Sorry, we have to adjourn at 12:45. With your consent, can we extend the meeting for 15 minutes? Thank you. I would like to spend a few minutes to share my observation with the administration. Referring to Table 5, in 2009, there are 52 sentinel events. In 2010, there are 8. In 2011, 5. Of course, we want to see fewer sentinel events. But this change is rather big. So, I don't know whether you have done some analysis to understand the reasons why. 2 hospitals led to 52 sentinel events. In 2009, there was this percentage. Because reports were submitted in a voluntary way, so the good hospitals, the well-behaving hospitals, took the initiative to report. Those bad hospitals would try to defer reporting, or even they would choose not to report, so there is underreporting. So here you can see 54% of cases in which some hospitals deferred their reporting or just didn't report. So I think the administration should come up with a mechanism where there are both rewards and punishments. Otherwise, the good hospitals will suffer from a loss of competitiveness if they report all the events. Those who didn't report doesn't mean that they do not have any such events. So there are 259 days in which no reports were made. So the rule is that reports should be made, or actually a verbal report should be made within 24 hours, and a written report should be submitted within 4 weeks. So some hospitals just wanted to defer things. Half of the hospitals did not adhere to the 24-hour rule. But then there is no concrete pressure on them because there is no punish and reward system. Secretary, you talked about international practice. Have you really analyzed international practice? Can you really combat underreporting? I would like to listen to your explanation. The good hospitals, i.e. the 2 hospitals involved here, made all the reports. Then what about the others? And are you going to introduce some punishments and rewards in the future? Secretary, you want to answer? Chairman, I agree with Mr. Ng that this is worth our paying attention to. We may need to enhance the rewards and punishments to improve the reporting mechanism. Usually at the beginning of such reporting system, there will be these cases. In some hospitals, perhaps they have done a good education and publicity work, and so more reports are made. And in some of the hospitals, fewer reports because they are more conservative. So when the system gets more mature, when there is more education and publicity, when there is better understanding, the situation will improve. Besides, there may be a matter of differences in understanding the nature of the events. In some kind of surgeries, there may be a certain percentage of complications, or is that a sentinel event? Is there a man-made mistake? But I do agree that we should take reference from figures in the past few years to consider whether there should be a clearer punish and reward system to ensure better future operation. Director, any supplements? I would like to add some reference information. Just now, members asked questions about Table 5. In 2010-2011, there are fewer sentinel events. Please turn to page 20. Table 4. There's a note under Table 4. The sentinel events checklist introduced in 2010 is such that we have taken on board the hospital authorities' approach to exclude common birth trauma and common surgical complications. As I explained just now, even though medical workers have done everything right, there may be these complications. So that's why in those 2 years, it seems that there is a sudden decline. Mr. Mlang Sing. I have one more question. Today, no member is medical doctor, but there are many medical doctors on that side, not on our side. Referring to the medical events, concerning reports submitted within 4 weeks, have you analyzed those cases? And isn't it necessary to categorize the sentinel events so that those who took the initiative to report will rest assured, because you will know whether a case involves human negligence or procedure inadequacy or natural error that is very difficult to be avoided. So if you can do a post-event analysis, then the public will understand more that the hospitals have done a lot of work. There are things that are unavoidable. There are good hospitals which reported the events promptly. Then in other hospitals, some medical events can be prevented or excluded. So I think by doing this, you can turn bad things into good ones. So this kind of commentaries or comments will help the public to better understand the events. Secretary or director, certainly this is something we need to do in the future. First of all, we need to make sure that we have the same understanding of the sentinel events. There must be a reward and punishment system. More training and publicity and education work should be done. And finally, the reports should be analyzed. And then the data and the cases should be shared with other organizations without jeopardizing personal privacy. So we can learn from these events. I definitely agree.
A moment.
Any more questions, Mr. Ng? I would like to follow up, Secretary. Just now, two members talked about two different views. Mr. Ellen Lang says that for two hospitals, they have already accounted for 50% of the incidents. And Mr. Lang says it's because this are good hospitals. So they try their best to be compliant. So can you explain more to us? Because when we look at the table, there can be different interpretations, and our two members have different interpretations already. Mr. Lang says that there should be carrots and sticks. So these hospitals are so honest, and maybe we should commend them. And Mr. Lang says that, well, there are so many problems with these two hospitals, so how are you going to deal with them? So can you give us an answer? Because we have to write a report, and we have to set out all the facts. And the next question will be asked by Mr. Wong Yok-man. Sorry, I jumped in the queue. Director, Chairman. Now for the classification of sentinel events, please turn to page 20. That's table 4. So after receiving the cases, we would analyze them, and there will be follow-up work. And for 5 of the cases, we have issued letters to the relevant hospitals. As for lessons learned, through the Patient Safety Digest, we have disseminated messages to other hospitals. Since last year, we have been sharing this kind of information through the Patient Safety Digest. How about the question I asked? Now, because this kind of reporting is done on a voluntary basis, so it seems that for those hospitals that report incidents, it seems that they have fallen into a trap. So can you tell us more about this? Now, according to the law,
There is a list of inspected items. However, the hospitals will comply on a voluntary basis, and we have also make reference to a WHO guideline. That is, for this kind of reporting system, it should be non-punitive. So it will take some time for the hospitals to get accustomed to this. We have looked at other countries' experiences. And for this kind of reporting system, it will take a certain time for the hospitals to form such a culture. Now, some people would say that for honest hospitals, it seems that they are just inviting criticisms. But now we are in a more and more transparent society. So when patients are aggrieved, they can make use of other channels to expose the problems of a certain hospital. So we do not only rely on the reporting by the hospitals themselves. Sometimes we would learn about cases through the media. So if this reporting system is getting more and more mature, then hospitals would know that if they report medical incidents in due course or at an appropriate time, then actually they can protect the interests of the public. So in your annual inspection, you should also disseminate such a message. That is, the interests of patients should be protected. Well, in the Code of Practice for Patient Safety, patient complaints channels, and the number of complaints received each year, all these are in the COP. Mr. Hon-yee. Chairman, about reporting sentinel events, some members have already asked a number of questions, and I'm not going to report those questions. But for paragraph 3.5, it says that DH received 137 reports of sentinel events from private hospitals and conducted on-site investigations on 17 of them. So it only accounts for 12% of the total cases reported. So how does the DH decide on whether an on-site investigation should be conducted? So after receiving a report, we will get more information from the hospital, asking it to give us an initial report. And after understanding, our professional team will look at the nature of the case and try to find out whether it's a systematic problem. That is, more than one patient will be influenced. So if that is the case, then we will conduct an on-site investigation. Mr. Wang, I'm more concerned about the making public or announcements of sentinel events. As to whether we should make such sentinel events public, of course we can discuss them more. Otherwise, you won't have two criteria for private and public hospitals. So for the privacy issue, of course, there are some justifications. Now, if you look at the WHO standards, I believe that is to allay the unnecessary panic of the public, and also that may also undermine the public's confidence in healthcare staff, and also people's privacy should be protected. Now, if these events are to be made public, then the doctors may have to face litigations about professional misconduct or making mistakes. So I have been in the media for a long time, and of course the people's right to know is very important, and we have to safeguard that. And I'm sure by making public these sentinel events, the relevant parties will be under pressure, so we have to strike a balance. Now, we have seen overseas experiences. For example, for the Denmark Patient Safety Act, I think it is something worthy of our reference. Now, it says that for all medical incidents, they have to be reported to the Parliament and the government. However, the Parliament cannot disclose the identities of the professionals involved. And for the frontline staff, if they are disclosing such incidents, and if they may be affected afterwards, then actually they should be protected. That is, these whistleblowers should not be penalized. Otherwise, these people would not be blowing the whistle. Now, Audit is making these proposals or recommendations. And for public and private hospitals, there are two sets of standards. However, for public hospitals, they may also have the same problem. So I think you really have to be very careful. Well, the public may exert pressure on you. They may criticize you, saying that you are covering up certain cases. So we really have to consider this. That is the fact. However, but there are still problems. People may ask you to disclose such incidents, and of course they have their reasons to do that. Now, if we just look at it from the angle of regulating private hospitals, we have to think about the problems the private hospitals are facing too. So for Act on Patient Safety in the Danish healthcare system, I think it is really worthy of our study. And now Audit has this kind of opinion, and LegCo also share that opinion. So how will the government follow up? I think when it comes to disclosure of medical incidents like this, for public and private hospitals, they should follow the same rules. Okay, I think this is not about this value for money audit report. So I think we really have to draw a line here. I think we should focus on the findings of the report. Now, at LegCo, many members are concerned about this. And they think that the DH should stipulate that the private hospital should disclose all medical incidents as long as patients' privacy is not infringed. Yes, I'm just trying to explain to you what our scope is. Secretary, I think maybe I can tell you my position. Yes, I understand that we always have to strike a balance, etc. And our inclination now is that in the future, if there is a sentinel event, and if that event, after disclosing it, may prevent the public from further damage, then we will announce that. And also, we will be disclosing figures, for example, on a half-yearly basis, because we need to safeguard people's privacy. And if we just see numbers, then privacy would not be infringed. Now, I would like to talk about the complaints mechanism, because it is very related to the complaints mechanism. Now, for the reporting mechanism. Now, okay, the patients, if they are the victims or the family members would like to lodge a complaint, then actually they can be complementary with the reporting mechanism. That is, if a case is not reported, then the patient may lodge a complaint. Now, for certain private hospitals, it seems that they can I provide you with a summary of complaints every month? So this may affect the government's handling of Sentinel events. So I would like to ask the Secretary, what remedy is there? Do you want the Secretary or the Director to answer the question? Because for the ordinance, I think the Director is the controller, and the Secretary can answer questions concerning policies, because we have to write a report, so we have to make it clear. So you can answer first, Secretary. I just want to be fair. We understand the division of labor. Now, of course, for implementation, the Director of Health would have to do that. However, we have to ensure that hospitals do such reporting at an appropriate time. So it's about our whole regulatory framework. That is, through what ways can we make sure that they report in a timely manner? Director? For hospitals and their submission of complaint digest to the DH, we will urge the private hospitals to do that in a more timely manner. Now, in paragraph 3.26. A total of 2,063 complaints have been received between 2009 and June 2011. And it seems that a lot of irregularities were found during inspections, but no advisory letter or warning letter has been issued. So among these 2,063 cases, how many irregularities are found? And how many of the cases involve professional misconduct? If we do not have statistics like this at the moment, I hope to see this kind of figures in the future. Can you answer Mr. Wang's question, or do you want to provide us a paper later? I will provide members with detailed information after the meeting. So you have accepted the auditor's recommendation. So why didn't you do it like that in the past? Well, we want to look forward, but we want to understand why in the past you haven't done that. In the past, when we looked at complaints, there were two channels. Now, if you look at table 6, this figures provided by private hospitals, and they are provided in the complaints digest. And some of the hospitals gave the report to us late. Now we are going to ask them to do it punctually. And after receiving such reports, our senior nurses, MOs, and senior MOs would be looking at these reports, and they would try to analyze whether Sentinel events are involved and whether there are systematic problems which warrant our immediate follow-up action. So for these complaints digest, we have not discovered Sentinel events. As for table 7, these are complaints lodged by the public. So we will find out more from these cases, and if there is a need, we will do on-site inspection. For example, case 3, complaint 1, the complainant says that he was given a triple dose of the recommended dosage of an oral medication during the stay in a hospital. So we went to the hospital to do investigation. And the ORHI found that the dispensing guidelines were not followed. He didn't use a syringe to measure the dosage. Instead, he poured it into a cup. So that was not a good practice. And the medicine was an antibiotic. So during our investigation, we couldn't prove that there was a triple dose, but the way he did it was not the best practice because he just poured it into a cup. So we gave him an oral advice. We also gave a reply to the complainant telling that we have given an oral advice to the hospital. As for complaint 2, a patient said that he was mistakenly provided with a bag of take-home drugs which bore another patient's name, and that after investigation the ORHI found the case substantiated. We told the complainant that, but the ORHI did not issue any advisory letter or warning letter to the hospital, but of course we have told the hospital what it should do, but we gave a reply to the complainant anyway. As for complaint 3, after investigation, we found that the case was substantiated. We gave an oral advice to the hospital. However, the complainant did not we didn't receive this complaint from the complainant. It was reported in the media, so we didn't give a reply to the complainant. However, we advised the hospital to be careful in the future.
Any more questions, Mr. Wang? I think the time is running short, so we'll have another session on the 30th, 9 a.m. I think we'll cancel the meeting on the 27th because we will be seeing each other on the 30th. Thank you.
Eleanor, 多謝晒你 very good leading. Okay, very good.